what do we do with a gentleman who has prostate cancer? Evaluate their heart. That's the thing that'll deprive you of your abundant life, sudden death. Most common symptom of coronary artery disease is sudden death. That's hard to treat. I don't have any remedy for sudden death. So we have to look ahead. Your insurance company doesn't pay for it. Would you stop already with the insurance companies? They are not the arbiters of your health. They're there to collect the premium. Your job is to stay healthy. Time to join the revolution. All right, so you have a high PSA, maybe you have cancer, prostate cancer. I guess that's why you're listening to the podcast, or you know somebody who has it. The question then becomes, are you going to die? Are you going to die from prostate cancer? What's the thing that kills most men with prostate cancer? I'm about to tell you. It's a little bit surprising. Now, I get it. Nobody wants to die. Well, most of us don't. You know, me, I don't know. I don't want to die like now, but the idea of never dying is creepy. So we all have an existential sense that the end of life will come. And now we ignore that so we can enjoy living. We like to just forget the fact that one day either you or me ain't going to be here. Now there's the existential sense of it. And then, gentlemen, you who've been diagnosed with prostate cancer, you who are harboring that elevated PSA, you who had that abnormal MRI, or if you haven't heeded my advice and went forward with a biopsy, you who have the Gleason score, will tell you why that's irrelevant in a moment. Have a clear and present sense of your own mortality. Okay, embrace that for a moment. It's not a horrible thing. It focuses the senses. Now, I'm not advocating that we passively allow ourselves to die from prostate cancer. I'm advocating that we're all going to die. We don't want to die from prostate cancer. And most importantly, at least in my experience, people don't want to suffer. They don't want to grind, limp, and wither. Many of you have had the painful experience of walking the path toward death of somebody who's dying slowly. It's god-awful. So what I want for you all is abundant life. And one way we get there is by not allowing ourselves to be exposed to things that compromise our vitality with the fallacious belief that it'll make us live longer. Chief among those things are conventional treatments for prostate cancer across the board. Prostatectomy, radiation, seeds. What about no? Just stop. Now, how do I say that? I'm not just making this up out of the top of my head. The studies are in, folks. The studies are in. They're not widely publicized because they threaten a multi-billion-dollar industry. There are two major studies that I glean most of this information from. But let's go to the heart of the matter, right? You have prostate cancer. What are you most likely to die from? According to the Petteruti trial, a study published in the New England Journal of Medicine in 2023, evaluated men with prostate cancer over 15 years on average. And they found that the most common cause of death was, yes, it was cancer. But no, it was not prostate cancer. It's other forms of malignancy. How about that? You have prostate cancer, you're most likely to die from some other kind of cancer. So what's going on? It's possible the treatment itself is so weakening to your immune system, so devastating to your cellular health, that it sets you up for cancer. Radiation therapy increases leukemia and lymphoma risk. Chemotherapy broadens the risk of cancer by virtue of weakening the immune system. Testosterone ablation. Testosterone is part of your immune system support. So all these things are relevant. Another common cause of death, number 2 actually in the Petteruti trial, again, not prostate cancer. It was heart disease, lung infection, and stroke, right? I can think of a few more horrible ways to exit than having had a disabling stroke first. But those were the risks, folks. So you have prostate cancer, do not overfocus on your prostate. You got to take a broad view. So what is a humble family doctor like me doing in the prostate cancer world? I'll tell you, because I can look at it from the outside in, take a step back and realize, what are we doing? There needs to be a revolution in care. We need to pull away from the gravitational pull of, oh my God, you have prostate cancer. We got to get you in right away and take out before. But no, just no. Okay. So if you're not going to die from prostate cancer, even though you have prostate cancer, then what should you consider doing? I had a gentleman in recently, he had a Gleason score of 6. That's right. He got a biopsy before he had a chance to talk to me. Never do a biopsy. I don't think you should ever do a biopsy. All right. We'll continue to dive into why. Gleason score of 6. And what do we do with a gentleman who has prostate cancer? Evaluate their heart. That's the thing that'll deprive you of your abundant life, sudden death. The most common symptom of coronary artery disease is sudden death. That's hard to treat. I don't have any remedy for sudden death. So we have to look ahead. If you're over 50, just get a calcium score. Why? It'll show you whether or not you have hardening of the arteries, whether or not you're at risk for future heart disease. It's a powerful prognostic tool. Your insurance company doesn't pay for it. Would you stop already with the insurance companies? They are not the arbiters of your health. They're there to collect the premium. Your job is to stay healthy. Your job is to pay your premium and get ripped off because you didn't use it again this year, right? How about that for a concept? Pay my premium, another year went by and I didn't need, to have bypass surgery. Oh, doesn't that suck? No, it's great. Anyhow, the prostate, the calcium score is an out-of-pocket expense. In our neighborhood, it's about $100, maybe $150. It's chump change. I pay more to fill up my car with gas. Not really, but yeah, I know, a little bit less. Anyhow, you get the point. So heart disease is relevant. Be careful of treatments. So what about the trial? One study published in 2017 called the Pivot trial. They looked at men with prostate cancer across the board. Half of the men got their prostate gland removed. The other half did nothing. Now pause and freeze frame for a moment. The concept of either ripping out your prostate gland or patting you on the back and saying, good luck, I hope prostate doesn't kill you. Well, doc, what do you got for me? We got nothing. That's not true. It is not true. Your body is fighting cancer every single day. You need to help it. You need to do things that support the fight. Now, I empathize with you guys because you're stuck. You have the urology community, the oncology community. You ask them what you can do. They have no knowledge of nutrition. They have no knowledge of supplements. They have no knowledge about what can be done. Repurposed drugs applied to help kill and prevent cancer. Rational, safe, plausible. So in the future, what I hope to see happen is let's compare the conventional approach to the Petteruti protocol over the years. Is it possible that we're actually instigating metastatic disease and accelerating the rate of cancer death by virtue of jabbing needles into the prostate gland? There is no known answer to that. Any doctor who tells you that, oh, don't worry about the biopsy, that's not been shown to spread cancer. All right, it's never been studied. It hasn't been shown because nobody looked. Now, it's going to take years, but those of you that are choosing the Petteruti protocol, without a biopsy, we're going to get a cohort of data that will be illuminating. To me, it is intuitively logical. If you stick a needle in cancer and you make a bloody mess of it, it's more likely to spread. The problem is we have no delta, no comparison group, because literally everybody gets jabbed because that's the standard of care. Established in 1980, and we haven't moved the needle? Killing me, folks. You're killing me, Smalls. All right, let's go back, though, to the stats here, because they're revealing. The Pivot trial, 20 years. Men prostate gland removed. Men did nothing. 20 years later, no difference in death from prostate cancer. What? But I had my prostate gland removed, doctor. How could I have metastatic disease? Well, I don't know, some of the cells, but no difference in death from prostate cancer, whether you get the gland removed or not. And here's an interesting detail. When comparing the stage of the cancer, the Gleason score, the magnitude of it, no difference in death whether or not you remove the gland. So this notion that you have to get a prostate biopsy, we have to know the Gleason score so it can help us decide what to do, is rendered moot when you realize that the outcome is the same, with or without the prostate being removed. So what is a man to do? You protect your health. You do not let them strip you of your manhood without a colossal upside. There's no upside, guys. Keep your prostate gland. And by all means, never, ever let them irradiate you. And here's the stats on that. So the PIVOT trial did not look at radiation. They just looked at yes, no surgical removal. 2017, 2023, the PROTECT-T trial looked at that element. Surgery, radiation, or nothing. Once again, no difference in prostate cancer death among all three groups. No difference. What are we doing? You're going to die, folks, right? Be prepared. Be prepared. This is a little bit of a reflective thing, right? I've sometimes wondered, would I rather have a sudden death episode, or would I rather get some kind of forewarning? It's like, I wish I could do a novena or something, before I die so I get into heaven. I don't know. Maybe I should be prepared regardless. Maybe that's a good idea for all of us. Anyhow, let's go back to PROTECT-T, right? Those three branches. It is true that there was a slight increase in metastatic disease in the people who did not do anything. But here's a fascinating detail. I think it's fascinating. Of the men who ended up with metastatic disease in the groups, right? The group that did nothing, and the group that had surgery, and the group that had radiation. After 10 years, when they acquired metastatic disease, the death rate in those three cohorts was 13% for the folks who did nothing and subsequently developed metastatic disease. So you do nothing, 10 years later, you get metastatic disease in your bone. 15 years later, 13% death rate. Okay. If you have the surgery to remove the prostate gland, 10 years later, when METs occurred, or if they occur, the subsequent death rate at 15 years is about 25%. So if you get metastatic disease and you've had your prostate removed, based upon the study, there may be an increased rate of death. Hard to explain why. The radiation group, after 10 years, if they get metastatic disease, by 15 years, their death rate was 70%. Wow. Think about that. Now, I know this sounds uncomfortable, guys, but the best approach, avoid surgery, avoid radiation, apply alternative treatment. Of course, I advocate the protocol I've developed, not proven to cure cancer, not proven to prevent its progression, but built on evidence of potential benefit regarding the repurposed drugs, an unequivocal benefit regarding lifestyle modifications, right? Chief among them, lower percent body fat. It's better then to wait to develop metastatic lesions and then treat them than it is to do so in a preemptive manner. That is, there's no good evidence that starting radiation or androgen deprivation or any kind of a treatment just because your PSA is going up, there's no good evidence it's going to help you live longer. It will make you feel bad. It will make you miserable, in all likelihood. So we have to really carve through the noise, and it's really hard. It's hard to get a full amount of information. The time it takes, like in the few minutes we've spent, that's probably as much time as you'll get with your urologist. It's hard for them to explain all this. Number one, they're obliged almost to do standard of care. How will the standard of care ever change if we're all doing the same thing over and over and over again? And these studies have been in the literature, and they're having some effect, but it's too slow. Too many men are being hurt. They're being overtreated. They're being scared to take steps that are not in their best interest. So as you contemplate your fate, guys, think about staying vital, staying healthy, living life in the moment, and don't let anybody put a timeline on your lifespan. Hey, if you have metastatic lesions as you listen to this, properly managed, you got years in most cases. All right, well, here's to abundant living. Have a great time out there, folks, and stress not, because stress is bad for your immune system. All right, team, I'll see you all next time.